Hi, my name is Kim-Phung, but I go by Kimmy. I am graduating with a Bachelor's of Science in Psychology this May.
Your research looks at intergenerational trauma in the Vietnamese American community. Why do you think it's important to you to bring these specific stories from kind of the academic and scientific space?
Yes, so growing up in a Vietnamese household, I often felt like these stories were deeply felt but never spoken about out loud at the very least. And there's just so much to it. There's so much trauma, resilience, survival, grief that I just felt was being felt by people who didn't firsthand experience it. And so there's like a lot of research that needs to go into it to explain why we feel the things we do, why it's affecting us now. And the thing about communities like mine, they're often underrepresented in research. So, and if they are talked about, they are merely drawn to just data points or statistics, but there's so much lived experiences and stories that are left unheard. And so that's why I think research in this field is like really important, because it creates spaces for communities like mine to be heard, like to amplify voices that have been historically unheard.
You served as the president of the Asian Student Association, so how do you think that leadership role has shaped how you view community well-being here at CU Denver?
Serving as president of Asian Student Association has reminded me that well-being is about belonging. It's about creating spaces where students feel valued, seen, and that their voices are heard. And so being able to create spaces where one person feels supported means that it'll become a ripple. And the thing about CU Denver being a commuter campus, I think it's often hard to find community. So you really have to put in what you want to get out. So I think it also just reminds me that well-being is deeply communal, and because one person feels supported, it'll ripple on. And people feel seen, safe, as if they belong, because they feel supported and they can share a bunch of cultural values. But I also always say that you don't have to be Asian to attend the occasion, so being able to be in the heart of Denver and being so involved with other people from different backgrounds and identities really gives them space to share and know that their identities matter.
For other first-generation students watching this, what's your best advice for starting and maintaining your own momentum when the path forward feels brand new?
Yeah, for things like that, I think it's always really important to remember why you're doing it. My parents are immigrants and refugees, and they came here with nothing to give me everything. So remembering that I have opportunities that they never had is kind of what keeps me going. But at the same time, it feels really hard to navigate spaces that that feels really uncharted waters. But knowing that I'm not alone, because I have siblings, peers, mentors, professors, a community here at CU Denver really helps me know that I'm always supported. One thing that keeps me going too is the quote, "There's many paths to the top of the mountain, but the view is always the same." So even though you're going a bit slower or faster than someone else doesn't mean you're not going to get there. And sometimes you have to take detours, but it doesn't mean that you won't get to where you want to be.
Looking ahead to the future as you prepare to graduate, how do you plan to use the momentum you've built here to redefine what healthcare looks like for the communities you've spent your time serving?
Yeah, I want to build a model of healthcare where patients feel understood before they feel treated. I think far too often communities like mine experience barriers to healthcare because it's inaccessible or it feels culturally disconnected. And so I want to be able to be a physician who combines medicine, research, and advocacy to let patients feel like healthcare is human. I think far too often people think that health is just treating the illness, but it's deeply emotional, mental, spiritual, and cultural. So I want to be able to be mindful of how to treat patients as people before their illness. Thank you so much for CU Denver for giving me the most wonderful 4 years of my undergraduate career. I hope to keep making an impact and give back to the community because it's given me